So without further ado, it is now 10 o'clock. My name is Lars Mønstrup from the Danish Committee for Health Education, representing the Nordic Health 2030 movement today. Well, a wonderful day it is. With me today is again three distinguished speakers talking about, well, health and collaboration across borders. And today also with a twinge of and maybe that's, well, it's a cold day in Denmark where I am. And it is, of course, December, but we've gotten a little bit of the Finnish mood with us in Denmark today. So that's very fitting, I suppose. I'm not sure, actually, Vertti, whether you're in Finland even.
I am in Finland, and it's minus 15 degrees in Helsinki, which is very, very unusual this time of year.
Well, but at least it shows that we in the Nordics are able to function very well, even in a colder climate. But today, of course, we're talking about not necessarily in the Nordics only, but the notion and idea about cross-border collaboration in the entire European Union, and based on the idea also of the European Health Union Initiative. Anyone that's been alive and kicking in 2020 or 2021 will know that health is, of course, a very foundational element in our modern society. And whether we thought at one point that health and healthcare would be a luxury that we were allowing ourselves, well, it's more like that this is actually the basis for everything that we do. So Vertti, Violeta Bulc, and also Bogi Eliasen with me today. Three different perspectives on European collaboration. And Violeta, let me ask you to begin with. You've, of course, with your background, both in your native country, but in the stint that you had in Brussels too, been a strong advocate for European collaboration. The European Health Union Initiative, in the intro for this webinar today, we talked about the why of the European Health Union. And I dared also to say, why not? It seems fitting to ask both why we should do more about health in the European Union, and also why we're not actually doing it already, 2 years into a devastating pandemic. But without further ado, please enlighten us. Why do you think that the European Health Union Initiative and cross-border collaboration on health is such a good idea?
First of all, thank you very much for having me and giving me a chance to share with you some of my thoughts. I hope they will be more provocative than enlightening, because this is a topic that really needs a broad debate, and we need to start bringing into our awareness really what's the future for humanity altogether. And I know that sometimes it sounds too big of a topic, but indeed the pandemic really showed us that if we don't act together as people of this planet Earth, then we all suffer. And let me go back to European Union. European Union is really this noble project, and we tend to forget that it's not a country, it's a project which is constantly evolving and is inviting all member states to share the common interests and to act together in order to address the challenges that sometimes appear too big for one country to be solved. And if nothing else, pandemic is one of those topics. Health is one of those topics. And it's not only health equals pandemic. Health altogether, even before there were a lot of attempts to try to bring some sort of unified approach, at least to our personal documents, and that we could carry our health certificate or health information with us wherever we go in order to be correctly then presented, and that we as patients could be correctly treated. But of course, the subsidiarity and the need to keep more of national-based solutions always prevailed. I do hope that this time we will be willing to talk, but we have to talk from the understanding of diversity that Europe is all together. That is on one hand our huge advantage, on the other hand our big challenge, because it requires innovation in modeling, it requires a European approach to solving the problems. And here we are a bit weak. So I do hope that in health, finally we will come together, put together a framework within which all citizens of the EU are recognized also as patients no matter where we go. And at the same time that we do understand that there are some local characteristics that are specific to either geographic location or historical development, and we need to bring them into consideration too. And this is where sometimes EU fails. We are really good in recognizing the generic needs, but then we are weak in recognizing the specific elements that are very much local. So this globalization is definitely a challenge for the future, and we are yet to find good models, good solutions to embrace both the collective and the need of individual member states or specifics of the individual region. So let me stop at this point, and I hope that we can have a good debate around that.
We surely can. And just as a minor comment, I suppose, or sarcastically, that, as you say, sometimes this is where the EU is weak. It's worth also mentioning, I mean, it is where we are weak. I mean, the EU, it is not a country, it's a project.
Absolutely. Absolutely
it is
right.
our weakness as much as it is anyone particular.
But this is a very important point that you're just making. What are structures? Yeah, our structures are just created by people. We create them in order for to support our better lifestyle, to be more safe, to be more can really develop as individuals. And we tend to forget that structures are created by people, can be changed by people, and are used by people. And so often we hear, oh, the EU, you know, but what is the EU? EU are citizens. EU, you have to be aware when you place your vote that those are the people that will decide in your name. And that's how then the structures get empowered and they deliver whatever their vision or mission or goals are. So yes, I mean, and health is here not an exception. It's just yet another structure that we use. And when challenged by such a severe conditions as we are currently facing, of course, all those weaknesses come forward even stronger. And if anything, the pandemic really reminded us that who is really under attack when things like that happen. And this is the history of the last 20,000 years. It's nothing new to humanity. It's always cities. It's always a bigger groups. So I'm lacking a discussion at this point to find good solutions for the cities, which are growing. You know, in Europe, already 65% of all population lives in the cities. Globally, that's even 80%. So yes, these are the questions that we need to start addressing. So how to organize ourselves, how to make sure that we can react properly, that we can react in timely, and that we understand that cities are more under attack in the circumstances like that than the countryside. I mean, right now we are more and more recognizing that in a way countryside is a safe haven. But why? Well, there are many reasons, and I hope that when we put together a health union, we will take them into consideration.
So this is also about good organization of people. The people comes first to organize this. And if you'll allow me, Vertti, in the Nordics, we would normally always recognize the enormous capacity for organization that the Finns have. Certainly one of your many good qualities. Even in -15, you're up and about and able to function. So seen from a Nordic perspective, the Finnish perspective, as Violeta pointed out, this is not a country. This is not this is a project of the people, and how from a Finnish perspective, certainly being good at organizing, can we go forward in improving our cross-border collaboration, not just necessarily in the European Health Union initiative, but in the Nordics as well, or among the member states, from your perspective, Vertti?
Yes, thank you. Well, from Finnish perspective, one of the big issues when Finland entered the Union in '95 was that all related to social politics and health politics should remain as a national politics. So it has been a very, very long tradition in Finland that EU shouldn't involve in our very good Nordic model. What comes to labor policy, what comes to social policy, what comes to health. And I personally see that this COVID pandemic has really changed attitudes what comes to health policy. So this traditional very long line of Finland, and I think that a Nordic line, all three Nordic member countries have shared very much the same view. But now we have seen that all Nordic countries are very small. For example, we have a very good structures what comes to healthcare. They operate quite well. They are efficient. They produce health. But when we enter the pandemic, for example, if we look at the vaccinations, I think every Nordic country would have been in this global market when these big companies are producing billions and billions of doses of vaccines. And so the amounts the Nordic countries and, for example, Finland would have purchased would have been so small that we perhaps wouldn't have been so interesting as a trading partner. So I think that this in Finland changed the attitudes very much, that we could all EU purchased the vaccines and distributed them to member countries, and we could really benefit about being a member of the big community of Europeans. And I think that and now when we are looking at the we don't really have a national debate about the health union. I think the big population in Finland is really not aware of the building of the health union at all. But what it comes to a discussion in NGOs and with us with the social and health ministry, I think there is a lots of good mood behind this initiative, that we see that all in crisis situations, but also broader, we need to have some common responses at the EU level, but on the same time respecting the member states, because every member state is a very different. Even here in the three Nordic countries, we have a very different healthcare models, how they are financed, how they are operated, and so on. So I think that there can be created some kind of a common umbrella which benefits all the member states, and I think that's good. And I even see that it can create some new thinking what comes to social policy, which we are not talking today so much.
Thinking of that is particularly, as you said, that there's not that much debate in the public on this. Surely that is also needed. I mean, the European Union is not simply a transactional kind of space for us. It is also a project, as I think you said that actually, Violeta, it's a project of the people, and of course also for the people. So surely the debate among the people is a very important point for us to ensure.
Yes, I think from Finnish perspective at least, and I think it's true in many countries, the problem is that there is a small people of very EU positive people having this debate. So, and we are talking a lot that there are, at least in social media and in the society, as a whole, there are bubbles that are communicating inside of them. And for the vast majority of the people, at least in Finland, EU is something good. It produces lower interest rates and mobility across borders and working opportunities. And for example, students can go abroad to study much easier than, for example, 25 years ago. But EU is not something that you really debate on in the whole society, or then it's one of those big issues like debt packages and that kind of things. And for example, now there is a big, even I can say a big debate on EU forest policy, which of course we have 2/3 of our country's forest, so it's a big issue here. But the health union is, I think it's still a bit too abstract, but we are trying to inform about this, and we are also having some seminars and that kind of here in Finland, that we try to promote the idea. And I think that the general idea amongst the people is positive, because we have really seen some progress. But I think that we are now having a big transition here in Finland what comes to health and social policy, because we are next year we will have our first regional elections. We only have had municipalities and state, and now we are creating this regional level, which is common in for example, in Denmark and Sweden, that there are regional counties which have responsibility for healthcare, for example, and social care in Finland as well. And that's the big debate here. And I think the health union is, of course, much less in your daily life present than this new big reform we are having next year.
An interesting development for sure. Will be very interesting for the rest of the Nordics, if not to follow how you fare with regions. It's certainly been a strong debate in Denmark. I'll say with a smile. But well, positive bubbles, Bogi. That's good. But people talking in silos is often not the way we would like things to be or continue. I think that you've been talking in a number of silos and frustrated to do so, Bogi. How do you see, I mean, are we continuing when we talk about the European Health Union to talk in silos? And if so, what should we do to break out of that chain of events or chain of stupidity, as I sometimes prefer it?
Yes, thanks. I mean, it's always fun to be in positive bubbles, but it might not lead to the change that we want to. I think, Lars, your boss, Sharon, said it very good at a panel debate we were in, that it doesn't really work to make everything outside the box if the ones that you need to move are still inside the box. So how do we bridge these things? And while I'm totally convinced that the European Health Union is something positive we should aspire for, we are probably not taking the debate at the different levels that we need in order to make it concrete. So as was just said now, regional elections in most countries have a huge impact on what you can do with health. So how do we separate these things? Because health will still be delivered at a specific location, always. That's a given. So how do we separate the things so we discuss what is needed to be on a higher European Union level without threatening that people get access to their care, and that there is some flexibility in how to deliver it, as the countries are very diverse. And I think, I mean, to me, there are some basic points to take into account. Firstly, so in this global movement health that we are working with, we have pushed forward a conclusion saying 80% of the health challenges are the same no matter where you are. So the diseases are the same. The maturity in the system to deal with it is very different. So what you get is also different. But why do we need to carve health solutions down in thousands of jurisdictions without thinking about if that's the best way to do it? I do understand the need for it, and that comes back to, can we try to think persons first and jurisdictions next? So that's one thing. And the other thing is, why do we have a need? The need has arisen because we have outlived the one-size-fits-all. It has served us well. It has taken us from a lifespan average of 30 years to about 80 in some countries, but it can't take us further. So the lifestyle we have implemented and the treatment regime to follow that is not very effective. We do not apply the knowledge that we have, or the way we apply it is in an old logic. So we are not utilizing the potential of it. And taking it on from there, that if we really want to become more precise and work with data, learning health systems, biological insights, there is no way we can do that efficiently in 5 millions, in 10 millions, in 20 millions. You need much larger groups to work with. You could probably start in the Nordics with 30 millions to get to proof of concepts, but once you get a step further in 5 or 10 years, you would still need to enlarge it to further groups. I mean, lung cancer today is 20 diseases if you want to work with it on a molecular level in that part. So that's the one side of it. The other side is what is health? To me, it's a question about dignity. So universal health coverage is not a technical device to show that your country can something. It's a dignity question. That's something we need to do. And the way we work from our department is simply to state that the most important pillar for a just and fair society, where you also get long-term progress, is access to health. It's not just access to healthcare, it's access to a healthy life. So what I think is probably missing is how do we separate the healthy life and the access to healthcare when needed? How can we work with those things? And a fundamental question I often ask in Denmark is our goal the best healthcare system in the world or the healthiest population in the world? These are two different things, and you would need to approach it in different ways. And I think we are still missing some of these questions in a European level. And what we have pushed very much, Lars and me, in the Nordic setting is to say, okay, let's just start with saying this is beyond politics. So this is beyond party politics. How do we push this at a level where you really, really get this done? And if we take this approach going forward, it's as much about correlating access to health with life conditions. So that comes back to the social policy. Can we separate long-term health from social policy? Probably not. And let's be honest about that. And I think we should appreciate that there are many good things in the European Union, for instance, with Horizon Europe, Horizon 2020, and those programs. We have the research infrastructures, but we are losing the potential on really using that force to become a leader. It's quite clear when we talk to people in Europe, we don't want the Chinese model, we don't want the Silicon Valley model. And then the question is, what is the European model? And that remains to be aligned on how we do that. But it's definitely a model which has more personal respect and protection built into it. So I do think, I already forgot what you asked me about, Lars. But I do think that a important part that we are underestimating here is is the leadership question. So if we want to change health to really become more holistic, because we still need the reductionist specialized care, but if we want to go more towards prevention, it needs a holistic mindset. And that's not leadership skills that we have developed the last, I don't know, 5 decades, something like that. So I do think that we have a lot of the components, a lot of the stepping stones, but going from stepping stones to a bridge, that is the task we actually need to push forward, and that needs work from all of us.
Yes, from stepping stones to a bridge. I think you touched upon a good number of, you may have forgotten the question, but you certainly found a few of the answers, or a lot of them. Violeta, you have a comment, and just let me ask you, the both of you, Vertti and Violeta, a question here. One of the things that Bogi pointed to is the fact that for some, especially research, we need scale. We need to be thinking big. Yet when we talk about involvement, the social issue, we need to think small. We need to involve people. We need to get them to understand what this big project is actually all about. How do we create that bridge between the large and the small? Violeta, I'm not sure that was what you were trying to comment, but still.
No, it's certainly the big question in the room, but allow me first to respond to a couple of thoughts that Bogi said, because I think they're worth expanding. First of all, when he asked how should we bridge what's in the box and what's outside the box, my proposal would be just remove the box and set up a new system. And that's what we're called for. We are in the 20th century is the century of systemic thinking. It's a century of holistic approach, ecosystem approach. So we are yet to learn really, especially in politics. Businesses have adjusted really fast, and they are readjusting incredibly fast. But in politics, we're still lacking innovative spirit. We're lacking this boldness change things that are no longer serving us. So I'm really inviting everyone to, maybe even in the field of health, we have a really unique opportunity now because we're challenged so much, to take the holistic view from preventive care, which includes, of course, the entire health system and the well-being, to preventive care, and to then actual dealing with the challenges of health. But once we take a bigger picture, and once we recognize the interoperability, intertwining of these subsystems, all of a sudden we will see that many challenges don't appear where they actually we see them, but the roots are in a completely different setup. So only when you have this system vision, you can recognize these interdependencies. And for example, if you don't exercise enough, if you don't eat a healthy food, if you're constantly in stress, if you have mobbing around you, if you have a lot of unstable families, of course that will reflect later on in health. And somehow we are ignoring that. Somehow we are focusing in this digital age, especially too much on the curing the consequences of a bad lifestyle. So, and pandemic is just one of them that showed us so dramatically that because we are putting now all the faith only in one basket, only in the new vaccine. But what about the entire lifestyle? You know, in order to be more fit to deal with challenges like that. That is completely missing. And where I see the EU's role is that it picks up the topic and the level of conversation where it becomes too big for member states to handle. where it becomes way too big for member states to deliver on. For example, what was said about the economy of scale and economy of scope. That, of course, needs a mass approach. And if you take a look at the European continent in a relationship with the rest of the world, of course, we have to recognize that only if we join our forces, if we work together, no matter which area you pick, only then we can actually play the role in this global scale. And this is something that it's bigger than any member state. And we've seen it with migration challenges, we've seen it with climate change, we've seen it now with pandemic, and with many other issues that are issues of the planet Earth. And now in this scope, European continent is one community. Of course, it has lots of neighborhoods. Of course, it has a lot of interesting characters that live in different houses and play different games. But from a little bit bigger perspective, we are just one of the communities on the planet Earth. And I mean, maybe we have this capacity to engage with others and lead. I hope so. We need to awaken our senses. We need to awaken our spirits, and we need to awaken our awareness that, of course, we have certain advantages because of the historic events, but we also have certain disadvantages because imperialistic past is not helping us today. You know, the countries around the world look at us in a very suspicious way when we try to collaborate and be inclusive and try to really act as a partner. So all that is now coming to a surface. And if you take a look at the civilizational view, I mean, take a look last 20,000 years, you will see that this is sort of a known model. You know, there were many civilizations that lived before, and interesting enough, many failed due to the pandemics because they could not handle them, because the deterioration of public services and the social framework, especially in the cities, because all pandemics in the whole history have started in the cities. Politicians couldn't handle, the leaders couldn't handle. And then very authoritarian leaders came to the top because people thought that this physical rough power will solve the problem, which made it even worse because this kind of politicians cannot think holistically, cannot include broader masses into decision-making and into the response collaboration. So the civilization disappeared. So what makes us believe that we're not gonna follow this path? I mean, it's been a pattern of the last 20,000 years. So let's wake up. Only if we collaborate, only when we work together, only when we include really people and citizens in a discussion and start trusting them. You know, we have to become aware that the eras when minority was smarter than majority is over. You know, with the modern communication tools, we broaden the scope of awareness so much. And because of this mass of information, what very simple rules will help us to move forward? Trust, transparency, and do what the heart tells you is the right thing to do. We have to connect mind and the heart finally and start acting holistically as human beings. And that's what pandemic brought so clearly to our plates. So are we going to respond? Are we going to hear this? Or maybe it's the end of Western civilization, who knows?
Well, while you were talking, Violeta, I was being very, I had a feeling of your passion, but your end remark was perhaps a bit sinister also, but still a lot of passion there. And I can see that Bogi has a comment, but I would allow Vertti to also comment here, and especially, I mean, so the role of the EU is to be better at thinking bigger and being better maybe of explaining it in simpler terms that would allow citizens to join the conversation, maybe, Vertti. Would you like to comment, or should we...
Yeah, thank you. Just, I think that the role of the civil society and, for example, patient organizations is very, very important here, because I think it's clear that the majority of the people can't really follow very closely the debate in the EU. They don't know the structures. Of course, the school system and general how to say, knowledge is in relatively good, I think, in all member states, but still following all the nuances in the EU processes, that's a big demand for a people whose ordinary life is directed to somewhere else. And I think that the patient organizations in all countries are following these processes. They have their own umbrella organizations based in Brussels or wherever, and they even have some kind of manpower to do this. And then the information comes to the national organizations, and they can transfer it into a language that people understand. I think that the role of the civil society in these processes, combining the big and the small, is very important. And for example, my organization has of course the role that we support our member organizations to get in touch with their own membership. And just two other comments. I think that the health policy, I think, is policy. As commenting to Bogi, that we should somehow try to raise above the political disputes, and I don't think that really can happen. For example, in Finland, it's the viewpoint of the traditional right-wing parties, how to create more equal healthcare, for example, and how to promote health, everyone's health. They want to privatize, for example, healthcare very much. The traditional left doesn't think that the privatization would lead to more equality, for example. So it's a very political theme, I think, that everything what comes to health and to social policy as well. For example, what can you achieve by cutting social security systems? Will it empower people to go to work, or is it going to deprivate them even more? So it's a very political theme. And just one final how to invest in health. We have here in Finland have been building, and of course in larger European perspective also, this economy of well-being, which is that I'd say that the basic idea is that it's that we are working together to build a good life for everyone. So if we invest in healthcare, in social security, in schools, it creates more health and more how to say, capable workforce, and that enables, of course, the healthy growth of the economy, which again brings resources to build the welfare state. So it's a positive cyclus, and I think that this pandemic has also boosted this kind of discussions in Europe and in Finland. So we really see that healthcare, for example, protective systems of healthcare and vaccinations and all this is an investment. So if we want to keep the economy running, we need to have good health. For example, this pandemic was a very good, that it stopped the economy very much and it hurt the economy very much. And that now we are discussing that we have a public debt in money, but we also have a debt in social security, over the health debts, because all kinds of operations and things are. So I think it's changing also the discussion of public finances and public investments, what is seen as an investment. And I think that's a very important development.
Indeed. So there's a chance of good investment that would lead to a positive cycle, or possibly a lack of leadership that would lead to utter destruction. Violeta. Bogi, I'm not sure that was what you originally wanted to comment on.
Yeah,
but
well, I think the comment, there are some comments on which goes for both. Mm-hmm. So I think so what was mentioned here on the investment is something that we've worked a lot with in the Nordic context, but also before in Denmark particularly. So how do we get the decision makers to really buy into that health as an investment and not a cost in it? And that's very important in order to be able to articulate anything that has to do with holistic thinking. because if that understanding is not there, you don't get the buy-in. But if I fully agree with Violeta that this is a paradigm shift that we need to push forward. But a paradigm shift also means that some dilemmas that we have today between extreme positions or polarities, we would need to join them into a new direction. So what doesn't fit in the old paradigm can fit in the new paradigm, and the courage to take these discussions. So for instance, I mean, we focus a lot on digital health, but in the European Union, we have spent billions on trying to make something work with anonymized data, and that's good for some things, but nobody wants to be treated as an anonymized patient. So let's face it, if you want personalized health, it's linkage data. That's what we need. And if we want personalized health, then let's put the energy in figuring out how we do that. We are spending a lot of money on privacy in an analog world system. The analog world is not going to come back. So if we want privacy, then let's figure out how we do it in a digital world, which is not the way that we are doing it today. So we are having some of these sunken cost issues that are taking a lot of attention and a lot of the development money, which we probably would need to take front on. And I think when it comes to the left, right, so or coming back to the politics in health policy, of course there will always be politics in it, but I think what we need to do if we want to get the positive bubble to actually be something across domains to get understanding is to have some common understanding on what do we accept as a level playing field, and how can we, I mean, why do we have different requirements for public and private providers? It doesn't make any sense to me. I simply don't get it. If we want to provide health services, because the countries are set up differently. If we're going to take head on the challenge with it should be more private or more public, we're going to spend 100 years discussing that. So our proposal has been, say, let's accept it's different, but let's make the same requirements no matter if you're public or private on these parts. And if we want to push forward WHO's 20-year-old idea of health and all policies, it actually means health and all policies. So that means that health comes into everything else. So we can't separate it. But that's why I'm saying we probably need to think in levels. So what is local and what is not on those parts. And if we believe in this new paradigm, it also means that new players are coming in. So how do we get them in, and how do we get them to take responsibility and a part of the risk on building this? That is missing. Somebody gains money with better health. How do we get them in and also pay a part of the bill on getting there? And my pain that we need to address with this is, yes, there is a part of the European landscape which has improved health, which is becoming richer, but there is also a part which is becoming poorer with less health. So the polarization, and even in the weakest countries where there's a progress, the polarization is still growing towards the richest countries. And then if we go beyond the European Union concept that we have worked a lot with, which we call the 1090, everything that's developed for health is for the richest 10% of the world. It does not take into account how do we implement this for the rest of the 90%. And the challenge, as Violeta was saying now, is not just a European challenge, it's a global challenge. So if we have to figure out a system for Europe, yes, but we need to think about the rest of the world. This is the core element of dignity as well.
I noticed you were clapping, Violeta, so I'm supposing that you would like to add to your clap a comment to this, maybe.
Thank you for the opportunity. When I said clapping is that when it was mentioned that we should not make any distinction between private and public. And that's one good thing about the EU. EU does not interfere with ownership. It's looking for a overarching solutions, and then the ownership is a matter of local level. So that's yet another element or role that the EU can play, that it can come above. And this discussion about the really solid paradigm shift that can possibly bring some good results in the EU is something that EU can moderate, because it goes beyond all the investments on a local level. While I'm saying that, I'd like to pick up of what it was said as well about the investments. And we have so many already analysis now that the quality of life means less expensive state. So this accountability and stewardship over health and well-being as an asset, I find very attractive to build on. And I can just share one experience from my previous capacity as a commissioner, when we try to bring the awareness of road safety to all stakeholders and show them how badly any kind of fatality or serious injury affects not only families, but companies as well. And it doesn't affect only the one that is really involved in such an accident, but it's a psychological negative impact that affects many others. And that is just an example how, again, we need a holistic approach, because the troubles appear somewhere else where the results manifest. And that is so much true. And I'd like to just bring another attention, like when I said quality of life means less expensive state, it also means caring, means a stronger community sense and collaboration. And we know that those communities that are close, that are engaging, that take care of each other, they also have a more stable health. So this relationship-based health system, this personalized health system, is really, really important. And it doesn't mean that we cannot find then a holistic approach to it. And with all the digital means, that's where the digitalization can really help, not to master us, but to support our better behavior. You know, that we can really, human capacity can be used for caring, and then technology can take care of the last phase where you really have to act and do operations, maybe across the globe, or to have a good avatar with all the information that tells the history of your disease. But we need to include social framework too, because many times you can have a completely wrong diagnosis if you don't understand the social framework within which this illness appeared. So I'm very much trying to support all these ideas that really bring the holistic approach, and this kind of approach can only be effectively discussed on the EU level, and as it was said before, then we can take it further on the global scale.
Holistic thinking. We'd like a tall order of holistic thinking. What you've also pointed to, especially I think Bogi and Violeta, is that we need a little bit more leadership skills, maybe. Certainly some more leadership. But if you'll allow me, Vertti, to then ask you, seen from a Finnish perspective, and of course, it's always tricky to be asked to give simple advice for something that's extremely complex. But how would you advise us? How can we build some better leadership skills, or even apply them, seen from your perspective? In this case, if you'll allow me, you're a young member to the EU, as opposed to a Dane, or an old member that this is a very dedicated old member that rarely gives any trouble to the EU. We would never do that. But as seen from your perspective, how can we actually apply some better leadership skills to start building them, would you say, Vertti?
Well, that's a difficult question, of course, because if leadership in EU, actually, well, leadership in EU and in every place, of course, requires some kind of vision. You have to need what you want. And that's, I think, one of the big problems in EU presently, that You really can't, because it has been a very long tradition, at least a decade, that this kind of populistic parties have argumented in many countries that everything bad comes from EU, and it doesn't really resonate very well to the big public, because they can see the advantages in their everyday life, but it has led, from my perspective, that you really don't advocate for EU, and you are very reluctant to say that yes, this is one of the things we should really give to the EU to do, and that's from in Finland, at least we have this kind of problem, and I think that you should be rather courageous to say that, for example, if you look at the health union, that yes, this is one of the areas where our population is so small that we need a larger community, we need cooperation, we really should take steps forward. And I think that's the one of the key things in leadership, that you have to have some kind of a vision, and we are in many cases lacking that kind of joint political vision. At least we in civil society, we have visions what to do, the researchers might have visions what to do, but what comes to the political sphere, I'm not so convinced that they really have a joint vision. At least it's difficult in for example in the Finnish perspective, and I think in the Nordic countries where we have these coalition governments, it's always easy to have some kind of a vision if you can build a government on your own, based on your own visions and own members. But for example, we in Finland have a 5-party government. They don't have a joint vision about many things, so to say, but that's, if put in one word, it's vision, and then you have also. But I think for civil society and some of the researchers, one of the problems is also that they have visions, but they don't have the means or to make them concrete. So after you have the vision, you also have to have some kind of a path to realization. And then you also need to have some kind of ability to make compromises, because you rarely get everything done in the way, in any aspects of life, precisely as you want.
Well, it would probably be an easier life, but maybe more boring if you could just get it off the shelf every morning.
Yes.
But being bolder about your vision and being better to apply leadership skills, Bogi.
Yes.
Violeta had this wonderful phrase about removing the box. Are we finally brave enough to be able to remove the box?
Well, yeah, let me try to get some stepping stones towards removing the box. So first, I think we need to admit that all of us here, and most of us still, are trained in a reductionistic mindset. When you want to apply holistic thinking, you are not going to take away the reductionistic, how can I say, peak performances that we have in system. We still need very specialized, for instance, in healthcare, but also when we do research in different ways. So it's not a question about either or, but the new paradigm is about combining hyper specialization and holistic at the same time. And these are very different mindsets. So very few persons that I've met have both. A bit more persons can manage both, but they're not many, right? So, and what also happens is that at some point, everybody gets pushed very hard on what they do. And what you do there is that you flee back to your safe zone. And the safe zone for everybody almost working today is a reductionistic world, because that's what we were taught to do, right? So the leadership challenge, I think, is actually quite big. So we might have the courage mindset to break down the box, So I invented a new English word at a conference I was hosting some years ago. So because we are talking very much about breaking down the silos, just like Reagan was trying to break down the wall some years ago. But in reality, this is about bridging between the silos. It's not about breaking down the silos. So I call that matrixalizing, which is not a word, but you get my point, right? So I think that's where we really need to work hard. And I don't think we are there yet where we know to do it, but we need to do it. And especially in health, if we are just, I mean, I can make a stupid analogy on how I see the health system today. This is just like that. If the rules of the roads were like a stock car race, and the public sector were paying for the reparation of the car each day, and we don't understand why this gets so expensive. Does this remind of something that we are doing? I mean, we are not beginning to work as early as possible, which has the best effect and impact on the person, and which by coincidence also is the cheapest way to do it, right? And if we just take the discussion in Denmark, but all of the Western European countries, we are not getting more staff to the healthcare sector. Let's just face it. So let's rethink and say, what can we do with the staff that we have? I mean, that's what you would do in any other context. You would not spend 20 years thinking about how can I get more nurses when you don't get more nurses, but figure out how do we solve the issues with the resources that we have. And that's another way of the, how can I say, the cynical side of system thinking or holistic thinking is, what can I do with what I have?
And certainly not necessarily continue our stock car race. So any good sort of, I mean, this is December, so it's the time for Christmas wishes. Violeta, how the key stepping stones that you would like to see in, I'm not sure whether you would unpack on the 24th, I suppose. What would you like to see on your, well, for the European Union? What would be a Christmas gift you would wish upon it?
Well, I don't have a gift, but what I have an invitation.
Even better.
We all continue to build trust and really start acting, excuse me, acting together in the spirit of creating a well-being for European citizens. And that those are the goals really of European Health Union as well, well-being for all Europeans, you know, strengthen solidarity, provide security, and make sure that everyone's voice is heard. But let's not just say the words, let's act. Let's live this kind of very, very engaging and positive goals. As I already said before, I just hope we can hold space for each other to dare to connect our minds and hearts and even spirits and be able then to take this holistic view. And a lot of new jobs will emerge out of that. You know, connectors are playing more and more important role and are these little stones towards this network-based society that Bogi was talking about. So my appeal to everyone is really, or invitation, just don't be afraid. Mm-hmm. Just go for it, because there is just so much reward when you engage and collaborate. And even if you have no clue really what's going to happen afterwards, when this is a collective, positive, let's say, innovative thinking, always something good comes of it. So let's have trust into each other and let's just build on that and build society that has that as a foundation.
A wonderful invitation for us all and a great way of going beyond Christmas into a new year. Thank you very much for joining me today. I look forward to continue this discussion and possibly not just celebrate Christmas, but enjoy a lot of good work in the new year too. So thank you very much for people joining us too. We look forward to continue our work towards cross-border collaboration within health and other sectors too, of course. Thank you.
Thank you very much.
Thank you so much.
Opportunity.
Bye.
All the
Thank
best
you.
to you too.